Professor Duncan Selbie, now here we are at the Healthcare Future Summit where you were giving the first keynote panel of the day, and I was wondering, as somebody who's just visiting us from Riyadh today, what do you make of the event so far?
Well, Rich, I'm delighted to be here. I've been a visitor to Dubai, particularly to the Health Authority over maybe 4 or 5 years now. And being here, being able to contribute to a conference that's focused on prevention, vaccinations, very important, most important, next to clean water, about how do we preserve and save lives. So being able to make a contribution here is something I'm very proud to be part of.
Of course, and you're no stranger to the region, and you're familiar with the regional landscape in terms of healthcare and transforming the future of healthcare. It's very exciting stuff that's happening. Now, you're giving a presentation a little later on what you just mentioned, prevention. Can you tell us a little bit more about what you focus on?
So, we know vaccinations make a huge difference, but they're not so important when it comes to non-communicable diseases. Of obesity and diabetes and the causes of those, diet, smoking and not taking sufficient exercise and so on. So I'll be sharing just some data and some interesting stories from other parts of the world where countries have been making progress in tackling these issues, which is it's a global concern, and Dubai are at the front of this, the forefront, and the Dubai Health Authority is innovating all the time. So I'm very proud to be able to make this contribution and to be part of this innovative event.
Now, speaking of prevention, obviously in the region we are now looking at a future where it's health before healthcare, and preventative medicine is one of the key aspects of it. Just your own insights, where do you see us going in the next 5 to 10 years, and when is, preventative medicine or value-based healthcare or precision medicine going to become mainstream in your opinion?
So we need to have healthcare, and we need advanced healthcare, and we need precision healthcare. But we also need to be thinking about these other wider determinants that matter to health. So prosperity is the biggest determinant of a health outcome, having money in your pocket, somewhere decent and warm to live, which is to say in Dubai, but to comfortable, where you feel safe, and where we have strong educational systems and an environment, lovely open spaces, green open spaces and so on. They all make a huge difference to health outcomes. So we need to think about health not just in healthcare terms, but in economic terms and in wider determinants.
One final question. If you had the power to change anything in healthcare tomorrow, you wake up and it's done, what would it be?
I would prioritise primary care. I would say the first port of call for 90% of everything that matters in healthcare can be delivered in primary care. And then you need really strong hospitals in support of primary care, but in that order. Primary care is supported by hospitals rather than hospitals leading healthcare and primary care coming in second. And the strongest health outcomes in healthcare terms are delivered through strong primary care systems.
Well, Professor Selbie, we look forward to you being part of the change, and thank you so much for being here with us today.